looking at what people have gone through. In 2020, so to say, the pandemic, and of course, you know the results of the pandemic, a whole lot of people have not actually come back to the normal way they used to, business-wise, so to say, and a whole lot of policies from the government too could shock you. And just this morning, we woke up to the fact that electricity tariff have been reviewed upward by 50%. All this, experts say, could also bring psychological trauma. But how can you manage these things? Because these are things, day-to-day activities. Some could appear to you as a shock. Some could just, well, you might not be able to know how to manage it. And psychologically, it might be a trauma. And so we are looking at this morning, staying emotionally healthy in the new normal. Staying emotionally healthy in the new normal. And we have two guests in-house. Dr. OVWIGHO EDAFE is a medical practitioner. You're welcome to the program.
Thank you very much.
All right. We also have a clinical psychologist in-house, Mr. NKPANG. You're welcome to the program.
Mr. Pang, as a psychologist, let me start with you because we are talking about mental health and how emotional health is being affected by this new normal. We are talking about COVID, the way we do in the society now, the way we wash our hands regularly, the way we do with our families. Things have changed. So let me ask you this first question as a psychologist. What are the effects of the COVID-19 pandemic on mental health?
Well, it has a significant effect, and I will try to break it down. The first thing is that it induces stress. What do I mean by inducing stress? The new normals are changes that never existed before, but are now what we need to do. For instance, in Nigeria, we're not used to washing of our hands at regular intervals, but now we need to learn how to wash our hands at every interval. We are kind of people that like shaking, hugging, getting close to people, but the new normal expects us to keep distances among ourselves. And even when I'm talking to you, I should not be closer to you. This kind of changes our lifestyles, and by that changes in our lifestyle, it brings about a lot of stress on us, because a lot of interpretations will start playing in. Like for instance, going to work and I cannot get closer to my colleague. My colleague might have issues. We are not individualized society. We are the kind of society that we live together, we get closer together. And the new normal also affects our business. Sometimes the business will shut down. It affects economic, and when it affects economic, it affects our business. So when financially we are not financial buoyant as we used to be, definitely we are not going to be happy. And when we are not happy, depression is set in. Now, many people have different kind of personalities. Let's look at one of the things that we have discovered during the COVID-19 era is issue of domestic violence. By the new normal, means that parents, couples who are naturally not bound to stay together, they are forced to stay at home together. And differences in personality will bring about issues, and brutalization might set in. And when they set in, homes are no longer at peace. Both the wife, the husband, they are not at peace. The children will no longer also be happy. When I talk about domestic violence, not only to the wife, it's not only to the father, even the children also faces it also. And this affects their state of mental health. So they will not be happy, and once they are not happy, a lot of things can roll in. Depression is the most commonest one, but most of this is because new normal forces us to change our lifestyle. So it becomes stressful. We need to learn new skills. Before we are not used to washing, we need to learn how to adapt to this. So the stress is much on us, and that stress, if we don't have adequate coping mechanism, we can break down mentally.
So it is affecting us on the higher side or lower side?
It's affecting us.
Okay, you don't want to put percentage?
Naturally, I don't want to, because I have not really been in touch with the statistics, but 80 to 85% it affects our lives.
Okay, Mr. EDAFE, medically, can you tell us what is happening, talking about effect of COVID-19 on our mental health?
Okay, thank you very much. COVID-19, it's very real, and the effects, they span between the psychological, the biological, and the social. On the biological, any individual that contacts any illness, of course, feels unwell. So that feelings of malaise is there. The fever is really, really difficult. Someone once described it as the worst illness that he has ever suffered. Because you're talking about a cough that is really, really distressing. Is it the breathlessness that you feel? Or the feeling that you don't even know if you're going to survive? So here comes this aspect that you have an illness and then you start taking medication and it doesn't go. Instead, it's becoming worse. You lose the sense of smell and taste. Of course, that affects the person biologically. Then when you now talk about the psychological effect, you're talking about the fear of dying and the fear of not surviving at all. Then you talk about the issues of the anxiety, the chest pains, the tightness of the chest, the poor sleep, and then the persistent feelings of sadness. Don't forget also that COVID as it is makes your relatives that know that you have such infection to stay away. Yes. So you're talking about this person cannot come into your house because he's aware that you have COVID. So you're looking at this thing, the care that you are supposed to receive, the support that is supposed to be there may be limited at such times. The long-term effects, they are going to stay with us. The trauma of having to leave your house. In fact, some persons had to do the test because they wanted to go on a trip, air trip, and then only for a result to come and they tell you that you are COVID positive, and then they're taken to an isolation center. The acute traumatic stress can actually lead to a breakdown. For those that are in the health sector, a lot of patients could not access care. Those that had other illnesses before could not access care because of the fear of contracting it. So you can see how much the multiplier effect is. That those that have hypertension, diabetes, they can't come to the hospital for their regular care. And for those that have mental disorders pre-morbidly, now that they were stable, the fear of it, they couldn't calm down. And even when they come, they just stay, they can't even express themselves fully. And so you see, the psychological breakdown is much. Then socially, of course, you're looking at distancing, like my colleague have said, we are a people that are close to ourselves physically. Now we are having physical distance. And then you have to do a lot of frequent hand washings. That in itself affects us. Business-wise, the multiplier effects are there. A lot of people lost their job. So you can see that it's all round. The effect, of course, is all round on the individual.
Okay, let me stay with you, Dr. EDAFE. The frontliners, the medical practitioners, in this period of COVID-19, how psychologically traumatized are they? And how do they cope? How do they try to stay emotionally healthy in this new normal?
It's a little bit difficult to answer because...
are they not affected?
Yes, they are. The effect is cannot be quantified by figures.
I know.
Because looking at it from the perspective of at the beginning, when a lot of happenings were going on in the US, in Italy, and then the UK, and then the US. And you see the first messages that you get to hear from the health workers were, please stay home, stay safe. Only come to the hospital because our facilities are overwhelmed. Now, looking at the frontline doctors that work both in the major hospitals and even in the isolation centers, you see that absence of personal protective equipment, not as much as the amount that you want available. And then you're talking about, at first, we had to even be providing for ourselves until the government finally stepped in. And even the quantity that they give now is not enough. So you have to buy your own mask, you have to buy some of your garments, you have to buy your hand gloves because the one that is provided is not enough, you run out of supply. So that in itself is traumatizing. And then when you now have to face these patients, and you're trying to help them understand that, see, a relative, you know the way we do our things in Nigeria, where one person is sick, but 5 persons come with the person to the hospital. Now you're saying, please, the results are out. Lagbaja is COVID positive. Please, the rest of you stay away. And it's difficult to get them to maintain a physical distance, because they will do the very thing, the opposite thing that you don't want them to do. So maintaining hygiene is a problem, even for the ones that you have already diagnosed. And then here comes the aspect of, okay, there's an emergency and you need to probably move this patient to the ventilator in the ICU. And there are little things that you would want provided, and the relatives just tell you that, I don't have any money. All the money that we brought is just for probably card, okay? So aside from those little things that are needed to make the healthcare work not being available, there comes the most traumatizing part, choosing to treat a patient, to keep a patient alive, and having to turn some away. Like you see in some cases where there were difficult cases where you have to choose between, okay, this person is brain dead, okay, and this other person needs the oxygen, okay? Sometimes health workers have to make such difficult choices. They even have to come back with guilt, whereby someone, maybe 5 persons come down with difficulty with breathing, and you know that he needs oxygen. These 5 persons need oxygen for a minimum of 3 days, maybe 72 hours. But because 2 have responded faster than the others, you have to remove that in order to give to those others that needs it even more urgently. So you say, you're having to explain to Mr. A why you have to remove the oxygen, because you feel he will still be able to cope on ordinary air. And then he's telling you that, do you want me to die? You want me to die? So it's a tough call. And then finally, I'll say, the fear of taking it home. That doesn't leave you. Because you go home and your child wants to hug you, and you're like, hey, wait first, let me go and do my rituals of cleaning. And then when the child coughs the next day, you are wondering, did I bring COVID home?
Aside from that, it's actually distressing to the health professional. That sometimes you are indecisive, should I protect, kind of try to preserve my own, or should I live for this patient? So it's kind of a decision we have to make. We know that we have to live for the patient. So it's a choice we have to make. And you know, a lot of factors come in, especially the stigma you face at home as a health worker. When you get back home to your own very house, your mother will tell you, bros,
go and clean up first.
That's stigmatizing, but you have to understand their fears. And should, in case you eventually cough while you're at home, they kind of, you have to be careful of not wanting others to be trying not to segregate, and your children might not understand, your wife might not understand why you need to keep a distance from them, because you're trying to protect them. It's psychologically traumatic. But however, we've learned how to cope with it. It's about the explanations you give to yourself. It's about the explanations you
I was going to ask a question, Mr. NKPANG. How easy or how difficult is it to stabilize a medical practitioner psychologically in this trying time?
Well, it's not that so easy, it's not that so difficult. It's about, first and foremost, stress is the product of how we perceive the interpretation we attach to things. He has made known some of the challenges we are passing through, the decisions you make. Why do you have to remove oxygen from this patient and give to another patient? Why? Why should you need to turn another patient? So it's the explanations that we are able to give, that we are doing this based on informed decisions. That helps us to, that okay, we are not doing out of our own, it's not our wish, but we have to do certain things because of the need that we need to do.
I'm actually referring to the medical practitioners themselves. We saw some videos online where doctors, even outside Nigeria, were actually resigned to fate, looking at the overwhelming nature of their job, looking at the overstretched nature of their being, and of course their job, just hoping for the best to come. You will see that they are actually traumatized. How do you take care of such people psychologically?
We need to there's what we call psychological education, getting them to talk about their experiences. And when we get them to talk about their experiences, from there we try now to look at their perceptions. Are they affected? In what way have these experiences affect their perception? And we try now to structure their perceptions by letting them understand certain things as that is not the way they think it is. Then two, we also try the aspect of provisions, making available some necessary provisions, like we talked about the apparatus they use in dressing. So if those things are made available, it reduces the stress in them. Then train them on stress management. What are the things, how do they manage the stress? So those are the things we expose them to stress management. Aside from stress management, are there problems? We expose them also to problem solving methods. What are the aspects? What are the things they need to do, the steps they need to take in making some decisions? These are things, like we call it supportive psychotherapy, that helps them to adjust. Some of them might also have issues managing their homes. Like I was talking about issues coming out from being stigmatized by. So we try now to put them on how to manage their homes, try to bring in their couples on how to understand. So those are the supportive psychotherapy we give to them that will help them now to face the job.
Dr. Edafe,
Okay,
okay.
Yeah, I just want to add that to a large extent, where the hospital management and the isolation facilities come in by providing the needed materials, it goes a long way. But more importantly, it is very germane that they schedule the work that the health workers do there. So you don't stay there from Monday to Friday. Do you understand? Where you have fixed duties, you go Monday, Tuesday, and then you are off duty for a while. So that days that you're off, you don't get to see things and you are able to recoup or recover yourself. But again, there is the aspect where the training of the health worker comes in, where he has to sit down and say, you know what, this is a job, but I need to take care of myself, which means talking to supportive colleagues, going for training, knowing when to switch off the television, knowing when to say, you know what, I don't want to see COVID and COVID again for a while. It's very, 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 very important. You see, and that's where even the society helps us too. You not coming into the hospital for common probably headache, it helps me because I know that you are safe. You not going to the beach and gathering, going to large gatherings and saying that there is no COVID, it helps me because it reduces the level of stress that I have to start explaining to you. You putting on face masks, because even in the hospital we have that, where relatives and patients come. They have the face mask. They pass through the gate with the face mask. But when they leave the gate and come into the waiting room, they remove the face mask. So it's almost like you putting on face mask to the consulting room, it helps me. So what you do on the larger society and what the management does helps. You, for the government paying the allowances as at when due and helping to increase the hazard allowance. Do you understand? For every patient, sorry that I have to say this, for every patient that I have to face, the level of risk is high, but you're going to pay me 5,000 naira. It serves as a demotivation. So when the chips are down, you're like,
it affects the emotions.
my life is only worth 5,000 naira. Do you understand? So sometimes government coming in and say, you know what, we need to increase this allowance to help these people understand that they are facing high-risk situation. It helps our psychological health, our health too. Thank you.
Okay, Dr. Edafe, I'm still staying with you. Before this COVID era, we were battling with mental health and the percentage of people coming down with mental health seemed to be increasing, and even the hospitals deal with those mental patients and becoming worrisome in some cases. But in this COVID era, does the percentage increase the more mental health people
Okay, that's a very difficult question to answer because it looks like you're saying, are you saying are the rate of mental breakdown increasing?
Increasing.
Yes, definitely it is because of several factors. You know, at the beginning there was a lockdown. People that have problems with mental health before now could not access care. So we had a lot of resurgence of cases, as in relapses. So they had to come to the facilities. The facilities have now increased, but yet the number of stable patients have reduced. So that's one. Then here comes this person that is the anxious, the worried well, where every illness is suspect. So we have said that COVID tends to affect elderly people more. So you see a lot of elderly people now, like when I have fever, are you sure I don't have COVID? Okay, when you have headache, I must have had COVID. So you have the case of worried well. Then, of course, social distance or physical distancing. So relatives could not visit themselves. So the support that they tend to get before has reduced. So of course, it leads to a lot of depression, anxiety, adjustment disorders, and then the people break down with disease, mental illnesses. Then also you must understand that some individuals, even in our society, have difficulty coping naturally. When people are hard hit with stress, they use substances. For some people, they become irritable and then they exhibit poor sleep. Now, their coping mechanism, ab initio, is weak, is maladaptive. And then now you're confronted with COVID on top of it. Don't forget also that the psychosocial stressors are there. Living with a spouse that is not supportive. So you're having differences, conflicts within the home. So all the factors are just there for increased mental breakdown. I don't have money, my business is not working. Of course it will lead to a depression. And then the person will come down. Now, it's even worse because I don't even have the fund to seek care. So you see that the effects is just there. So yes, there are increasing cases of mental disorders.
Okay.
If I might add, the increasing cases might not actually be captured because many people don't even want to be identified as having mental health. So most of them might not even want to come out. That's the major issues we have, even in Nigeria.
So clinically, they are not identified.
Clinically, they might not be identified. They might not even show up.
Okay.
So those are factors. But you will hear issues of domestic violence at home, suicide becoming at increase. What are these things? These are pointers to possible indicators that there are a whole lot of mental health cases that are not well sought for treatment. We are having issues of increasing suicide. Why? Questions must be answered. One of them might be because of the pandemic. If you look at the rate of suicide during the pandemic, it was at an increasing level. So these are issues that there's no two ways about it. When there's a pandemic, there's bound to be mental health is bound to be affected.
All right, let me come back to Mr. Mpang. Yes, when it comes to depression, for example, because if we look at what people go through in this new normal, if one is not very careful, it's about depression. You might not be able to go out to your business. The pandemic is affecting your business. And of course, a whole lot of policies might not augur well for you. You are doing things you are not used to. But to come out of depression, what do psychologists do to patients?
Well, there's something we call cognitive restructuring, or CBT. That's the basic treatment we do. And what I mean by CBT, the C there is the cognition. Trying to see how do the patients view the problem issues at home. Does it view it to be negative, as negative? Because the way we think determines the way we behave, the way we react to things. And if we are the kind of people that have more of the negative thinking pattern, hold more onto the negative. But I mean things that everything that happens in life has the positives and alongside the negatives. But if you choose to see more of the negatives, it has a way of affecting you. It holds you back. It will not take step towards addressing the problem. So So what we help you to do is also to try to let you see the positives that also comes along in the challenges, and help you now to hold on to those positives as a way of moving on. Then aside from that, we look at other aspects of your behavior. Some people have problems because they could not actually cope. Stress management, you can expose them to stress management if they need to be trained on stress management. But the basic thing is that how do you go on resolving the problems and training on problem solving skills. But we hammer more on the aspect of your cognition, because that's what matters most. Many of us have issues on the way we think, the way we interpret issues. We see more, for instance, if we see the leg is paining us, we begin to look at that. The leg that is paining us might be a product of being wishful, being attacked by witches. That interpretation will not allow us to seek for what? Medical help. And the problem will get worse. So we try now to restructure the way you think, the way you interpret those issues. Now, as it goes, if it has to do with that of money, how do you manage your money? The little that you have, how do you manage? You need to understand. And if need be, we can then expose you to management, financial management trainings. This is how do you manage money? What are the things you need to do? How do you draw your financial budget? Just to help you adjust to the present reality. So those are the subtle ways we try to help individuals adjust to the realities that they have found themselves.
Okay, Dr. EDAFE, let me ask this question. The coming of COVID-19 was actually an eye-opener to the neglect the health sector has suffered many years. Now, from you are there, from what is happening now, will you say we are being serious in turning around the health sector to face major health challenges in the future? And of course, if we are serious, how long will the seriousness be for us to get to a very appreciable level? Then you can beat your chest and say, okay, health situation in Nigeria, yes, we can combat so many issues firsthand without actually panicking, so to say. What's the situation like? How long will it take to get to where you health practitioners think it should be for us to be able to say, thumb up?
Thank you very much, sir. This one has to do with the government,
yeah, sure.
Especially. And if you look at it critically, I don't know if the budget has been passed for Ogun State. I'm not so sure. But I think that we could start with the budget by at least increasing budgetary allocations to probably 20 to 25%. The issue is when it started as at last year, we had to hurriedly build an isolation facility, which ab initio should have been there. Do you understand? And we don't know how much, you have to, these things cost money. In those isolation facilities, you need ventilators. You need some machines that will be monitoring the patient's welfare. Now, at the height, in March, April, May, foreign governments were releasing ventilators as gifts. But I felt that even as it is, we cannot leave it only for government. Individuals, social clubs could still release these equipments that we need. Because the truth of it is that even as the government gives 25% of budgetary allocations, the individuals approaches institutions, because you can't wait. If you go to the Federal Medical Center and say, okay, MD, what do you think I can give you? We have notable people in the society that could assist. Just one donation you give might go a long way. I am from the institution in Arrow, and we are trying the best that we can. But I believe that patients that have mental disorders are special categories of people. And we should pay attention to them. But you know what happens most times? The government sometimes look at the physical ailments and says, okay, no, let's go to the general hospitals. But the psychiatric facilities are there because the effects, mental breakdowns, are usually longer. So you can treat this person physically, but the person's illness is emotional and psychological, and they are prolonged. So what I'm trying to say in essence is that increasing budgetary allocations is one, good-spirited individuals donating and going the step further to ask the medical directors of areas they can be of help will go a long way. And then finally, I want to talk about the laws. Sometimes it's not enough to increase budgetary allocations, but making laws that will help us. Like take, for example, I know we've talked about making it mandatory for people to put on social, wearing a face mask. That's a good law. But beyond that, enforcing it will go a long way. We're talking about, okay, even in public spaces, enforcing these laws, I believe it will help us. And then finally, even corporate organizations too, they should step in.
Okay, I'll still stay with you. How much of a psychology is in a medical doctor?
I didn't get you, sir.
How much of a psychologist or how much of psychology is in a medical doctor?
The question is,
I mean, what I'm trying to say is that as a medical doctor, are you to an extent a psychologist at all? Do you need psychology without inviting a clinical psychologist? When do you think you need to invite a clinical psychologist? That's why I say, how much of a psychology is in a medical practitioner? The one that is not professionally psychologist, yes.
Okay, now I get you very well. As much as possible, as part of the training of a medical doctor, is to be aware of symptoms and to be able to piece the symptoms together. So as long as we make diagnosis, sometimes you're allowed to reflect. So you reflect and you know your limits. You know, one of the good training, and even my boss even said it again yesterday, was a good doctor is not the one that treats all cases, but a good doctor is one who knows his limits and knows when to invite the next person, the senior or whoever. So we know, as part of the training, we know when to call and say, please, I need help. So a large extent, most of the people that work in isolation center and frontline staff as doctors, they understand when they are breaking down and they know when to call. That I can say.
So, Mr. Mpang, when do they call you, or do you normally work hand in hand? Because we are looking at mental issues now. When you're looking at mental issues, when does it become the job of a clinical psychologist to take over? Or you work pari passu, hand in hand with medical doctors to get the job done?
Actually, the major treatment model we adopt helps us to work hand in hand.
Okay.
It's not the time that the doctor does it. So
Okay.
Later you come.
we work hand in hand. That's why we adopt what we call the psychosocial model.
Okay.
Which you have the psychologist, you have the doctors to take care of the biological aspect, the psychologist comes to take care of the psychological aspect, the social workers are there to take care of the social issues. Because we serve as differential diagnosis, what we call differential diagnosis. What the doctor will actually focus on might not really be having to do with what I will see. But by the time I can draw the doctor's attention to certain things, and if he sees it with me, it makes it just better. But actually, there's a clear-cut demarcations in knowing when to give up. Now, we deal with the behavior.
We deal with the behavior. You start from there when we come back. We deal with the behavior. That's the key. Because we're taking a break now quickly, even though we're still looking at the topics, staying emotionally healthy in the new normal. When I come back, Mr. Mpang will actually continue from where I stopped. Let's take this break. We'll be back.
Dear customer, link your Airtel number to your national identification number today. Here are easy ways you can do it. Dial *121*1# on your Airtel line and follow the prompts on the screen. Type in your 11-digit government-approved NIN number. You will receive a confirmation message to confirm your entry. You can also visit www.airtel.com.ng/NIN to link your phone number to your NIN. If you do not know your NIN, simply dial *346# to get it. No stress, no wahala.
Airtel, the smart.
still looking at, you welcome back, we're still looking at staying emotionally healthy in the new normal. And of course, I was actually, Mr. NKPANG was actually reacting to the kind of
Behavior.
Okay.
As a clinical psychologist as a whole, our discipline focus on behavioral change. What are the behavioral change the patient needs to undergo? Because we believe that there are some of the illnesses that might come of that might affect either our behaviors, or maybe in some ways we have been behaving in some other ways that are helping them to bring about the illness. We need to change those behaviors. We need to modify them. We use the word modify. So those aspects is what we try to do. Try to come up with programs that will help in shaping those behaviors in order to give us healthy behaviors that will help promote the healthy living. So that is an aspect. But when it's a client, we discover that if a client also needs some form of level of medication, that's when we know that it's not within our purview to go into that.
Okay.
We need to bring in the doctor who does the aspect of the prescription and manage that aspect.
Okay.
Then there are some aspects in the medical treatment that is not really strictly their own domain. Like when it comes to personality disorders, they do not really have the sole right to make a personality disorder diagnosis. They will need assistance in assessment. So they have to actually fall back to us to make some form of assessment. And
So you work as a team.
So it's a teamwork. They cannot individually say, I am everything. They need me just as I need them to make the whole treatment package complete. So that's how it plays. Same also, I need a social worker to do some family dynamics, to undergo some home visitation, to give me information that will help me in drawing of my programs. So I need also to draw me a social work, refer to a social work for their own input. So nobody can actually say that I'm an idol, I'm kind of a king, I don't need others in the health sector. We need, and in some form of a training, the doctors are trained to have a basic knowledge about psychology. Those have also been trained to have basic knowledge about the medications they use, the possible effects, the behavioral, how can it affect. So we have this knowledge about interwoven knowledge about this, but in clear cut, there's a demarcation in our practice.
Okay, Mr. Pan, I'm still staying with you because in this era of pandemic, we know that children are also not left out because in the home, especially when a mother or a father falls sick and having COVID-19, the children will feel that their parents are not around. So what is the psychological effect of COVID-19 on children in this era?
I want to talk more on the aspect of separation attachment.
Okay.
The attachment bond somehow is being severe.
Okay.
Like I want to use my own practical life as a case study. When I come back from hospital, my children naturally before they are kind of people that flock around. When I come back, we hug each other, carry me, and all this stuff. And now imagine now coming back when a child comes to me to carry, I say, hold on, let me go and clean up. It's like children first and foremost will say, what is wrong with my daddy? Why is my daddy changing? They don't understand. Sometimes we need to sit them down to explain. So if we don't offer them those explanations why I need to do certain things, they have a notion about, they started having the wrong notions. And they will not be happy about that. So their emotional aspect of them, they become depressed, they become sad. They started picking those things as if daddy doesn't like me any longer, and those things can lead them to break down, emotionally break down. They may not want to come up to tell you these things. Then aside from that, due to financial implications as a result of the pandemic, some parents become unnecessarily irritable. They become nagging and a little attempt of children to come and welcome their daddy. Get out of me. Any little reactions like that begin to set in. And children who have naturally never seen their parents that way, some of them sometimes becomes victims of brutalization. Not because the parents actually wanted to do that, but because of the parents are not happy, they could not actually control their emotions. So they act it out. So the child becomes like a victim of the circumstances they are passing through. Then now looking at the aspect of the educational system, this children's educational system has been affected. They couldn't go to school any longer. Some of the time, so it affects them when they discover that they could no longer go to school. They have questions to ask, why am I not going to school? Why? What kind of a nature of things are these? They will not be happy about that one. And the worst of it all is that they are now being they left at home. They are being asked to stay at home, doing what? They become unnecessary because as a child they will have to play. And the stress mounts on what? Their parents. And most often the mother, because the father might want to, if they are both around, when the stress becomes so much on them, what do you think will be the end product? they will be laughed at. The parents will want to act on this. So this affects the emotional health. Knowing fully whether your age is progressing, things are not moving, you will be psychologically down. The child will be psychologically down. Will not be happy about what is happening. Sometimes if their favorite television programs like some of the time that they like the cartoon networks, and due to the implications on the family, they're not finances and they cannot pay for those things, they will not be happy. Their favorite meal styles will be changed because of what parents are trying to adapt to this present situation. They will not be happy. And this begins to make a whole lot of meanings out of them. So at this point, I always try to clamor for parents sitting down their children to try to explain things, engage them in discussions, engage them to explain things to them why these changes are existing, so that if they could get that interpretation, it makes them able to cope with the realities we give. But even when we negate them and feel that because they are children, they don't understand and put them aside,
they will not understand.
They are forming impressions about these things and it's bothering them. And the next available person that shows them that love, they cling to. And that's why most of our children during this period of time are prey to what? Substance use. Okay. Because they will need somebody who's going to be listening, who's going to give them that love, who's going to give them that joy. So if they find it outside, they want to always be outside. They want to go out, they want to play. By so doing, they have to learn certain things that naturally was not part of them.
So, Dr. EDAFE, how do you think children can be lectured in this period?
Okay. Bearing in mind the problems that he has outlined, it's key that parents should find a way to engage these children. It's actually an opportunity for the child to be groomed on house chores and responsibilities in the home. Okay. You know, before now, they are rushing to school, so by 6:37, they are already out of the house. So, but now you have to place that structure of house chores, and then as much as possible, you try to use common language to explain to them what coronavirus is all about, and then supervise them in washing their hands and using the sanitizers, and then proper use of the face mask. Sometimes you see this advert that is fine, that is very children friendly. Some days ago I saw it on the TV, and it was a good opportunity for me to reinforce the training on physical distance and what coronavirus does to individuals. Because this child doesn't really understand why I am not going to school. Why am I not going to school? Why is school not resuming now? So you need to explain and possibly re-explain. Now, more importantly for me is what I saw in the public schools, where because of space, they said the lecture period was scheduled. So between 8 and 11, some set will come to school, and then between 11 and 2 or 3, another set will come. Now you see on the street, when you're going on the street, you see a lot of students on uniform. You don't know which category are they. Are they for morning class or are they for afternoon class? So like he said, they become a prey for, there's enough time on their hands. And don't forget that these are teenagers. Teenagers are explorative. So they start using substance, they start going into heterosexual relationships and sometimes homosexual relationships. And sometimes you see this thing, parents need to resume work. So they leave their children in the care of anybody that is senior in their environment. Of course, you are exposing the child to molestation if you are not observant. So parents need to be observant about their children. And then, of course, like he mentioned also, keeping these children busy with, you want to use cartoon to keep them busy. No, it's not right. And the reason for that is that, okay, you kept the child busy from 8 a.m. when you had to go to work till 2 o'clock when you had to come back. And from 2 o'clock when you had to come back, you had to rest. So you put in another cartoon from 4 till 7 when you start watching news. So 12 hours, this child watched cartoon. So you're not developing the child mentally. So what some parents do is that they do homeschooling, which means the day I'm not going to work, because I'm a level 8 or level 9 person, I gather the children in the area and I teach them the one I know, English. The day you are not going to work, you teach them mathematics. So we rotate it amongst ourselves. So that way the child is not left hanging. For sometimes they can do it in the sense that they could get this person that maybe is waiting to go to the university because of ASU and say, okay, why not teach all these children in this area? Just keep them busy. That way you will be able to monitor this child effectively.
All right. I know that leadership comes with lots of challenges, especially at these trying times where everything, the good, the bad, or ugly, is heaped on the governance, is heaped on government, is heaped on leaders. So my question now is, hey, do the leaders, our leaders need psychological help in these trying times? Do they need psychological help? And if they do, how do we go about this? Do they know they need?
The answer is yes. Because the head that trying to feel. And that's one thing that we need to actually also try to bring in to the understanding. Because you have to be aware when to retreat, just as my colleague has said before. Because when things are hard on you, you need to take a risk. You need to stop and take a breath. But as a leader, we want to, because of the cry of the masses, you might be tempted to do what? To want to go all out, to give them all, but it's not that so easy. You are, of course, a human. So leaders must know when to take a break, irrespective of how demanding the task are. They need to know when to take a break. And they need also to know when to access services. It's so pity that most of our leaders do not really understand the essence of break, holidays. Even at holidays, we find them work. At holidays are when they need to break out of the system, take themselves out of the system. So that the bottom releases on them. And that's why you have so many of them that have come up with a lot of coping mechanisms that are no longer helpful. Most of what we see our leaders do, they're trying to cope with the situations. And coping, they don't allow them to give their best. Because the stress are enormous, they need to cope, and they don't want to appear like being a weakling. So in coping, they adopt several mechanisms, like they will talk to you, use some words, just to kind of, some of them will even deny the realities, like telling you those realities are not actually real, but they know that the realities are there. But if they accept that the realities will be real, ask them what will they do? So to cope with it, they might want to say what? No. So they need some form of stress management. Every leader needs to be exposed to stress management.
Okay, Dr. Edafe.
Yeah, if I will add to that, leading the people comes with a lot of responsibilities. And in offering your service as a leader, you need to check in with the experts to allow them to assess you periodically. More so because of the trying times we are in. No leader will be able to function fully when a people are protesting. I'm talking about the NSAS protest. It's traumatic for you to watch the few facilities that you've been able to provide for the people being vandalized. You understand what I'm saying? So at such times, beyond singing, beyond administering, the people in authority as politicians and as policymakers, they need to come into the health sector. For two reasons. One, to see what the health sectors are even doing. Because if you say that you have put people in charge of the health of your citizens, you should visit the facility to see what they are doing. That's one. And then two, to speak with the experts in that facility, to assess if what you have provided is enough, and to see if you need their services too. Because in speaking with a medical personnel or health worker, he provides information and then he helps you see things from a different perspective. That's what he mentioned when he talked about cognitive restructuring. So that in itself might just be life-saving. Because you can imagine that in advanced country like the US, where COVID-19 is ravaging, you see that even the new government that has not come in has already gotten advisors for COVID-19. From time to time, they have to listen to the experts and they have to check in to see if they themselves are okay. We are humans. So if you see it from the perspective that I'm a human, I can get sick at any time and I will need a doctor to perform an evaluation. Then you won't hesitate to ask for help. So I think our leaders, periodically, at least twice a year, should come into the health facility.
Well, I want to stress a bit on that.
Yeah, go ahead.
It's important that our leaders come seek medical clearance, check-up, because it's not so easy as a leader to see, like, let me use the incident of Boko Haram, killing thousands of and hundreds of citizens, kidnapping all the time. Some of our leaders are actually facing threats of attempted assassinations and all this stuff. Those things can pose mental health challenges to them, which some of them are actually having, like post-traumatic stress disorders. If you merely escape from the incident of an attack, going back home, you are still someone affected. So there's a need for our leaders to seek medical help, not just because, the thinking is that most of our leaders think that by seeking medical help means that they are not fit enough.
They are exposing
It's not like that.
themselves.
It's not actually like that. It's actually to help them to deliver their promises.
Okay, there's a common. Okay, let me just tell our viewers that we're looking at staying emotionally healthy in the new normal. What has been your experience? What will be your contribution? What do you think should be happening? What do you think the psychologists and the medical practitioners should do? And if you have a personal experience, or if you have a question, you can also ask. The number will be on your screen. You can be part of the program too. We have two experts in-house. Dr. OVWIGHO EDAFE is a medical practitioner, while Mr. NKPANG is a clinical psychologist. While we await the call, I don't know, I want to read your reaction to, okay, we have said a lot. We have said how it should be, what should be done for things to actually look a little bit better in this trying time we are all in. Some people will tell you that it is not only this nation that is facing the trying times, but it might be difficult for people in Nigeria to actually stay emotionally healthy in this new normal because of some peculiar challenges. And if the peculiar challenges are still there, what will be the place of you medical people in trying to make us stay normal? For example, when there is lockdown in some other clime, you don't have any reason to break the protocol of lockdown because you have all that you need at your doorstep. Electricity is working, water is working. When you wake up in the morning, maybe you find all that you would need as an household because there's a proper data. They know that 3, 4, 5 people live in this house. They know what they care, what they need. Even in school where you're supposed to go to, you still go find time to go and collect the break items for your kids, the food items you bring back home. So to say, we knew what happened in Nigeria. People were locked down, no planning. They were actually majorly artisans, roadside traders who need to make 1 or 2 naira for them to survive. What were the plans for them? Nothing. Palliatives were shared in shambles, not properly. There were issues here and there. We saw palliative, we didn't see palliative. Some people are giving up. Now, if you look at all these challenges that we have in Nigeria, is it not a mirage to say we have people that should stay emotionally healthy in this new normal?
Thank you very much, sir.
That was a very long question.
But it's germane, and I think I appreciate it. Living in this, despite all the challenges. A lot of people have said that Nigerians are the most happy people, and I tend to agree to some extent. In spite of the economic challenges and difficulties, it's important for you to stay alive. And staying alive are the little things that we are emphasizing right now. It is possible to to stay emotionally healthy. You must believe it, and it is. It is possible to stay emotionally healthy. The few things that each and everybody needs to do, just do it for your own family. Don't do it for the next person. Do it for yourself. When you realize that you are stressed, please avoid the stressors. Try to focus on things that make you happy. Yes, there is physical distancing, but thank God for phones and internet and WhatsApp. Please keep in touch with your friends and loved ones. When you realize that you need help and the things that you need to watch out for you to say, I need help, when you're not sleeping well, your sleep has changed, your appetite has changed, you are distracted easily, you are not composed, you're suicidal, you're thinking of death suddenly, maybe because of what has happened around you. And you realize also that you have lost interest in life. The things that makes you happy before, you're no longer doing that. That is enough reason for you to say, you know what? I need help. And where is help?
Let's take this call. Hello. Hello, good morning.
Good morning.
Your name?
My name is Damilola
From where? Hello, Damlola. Oh, we lost it. Network problem. The network too at times are emotionally unstable. We should understand. They are actually trying to actually know in this new normal, they are also affected. So we should understand. Yeah, you want to actually conclude what you are saying?
Yes, we're saying that, you know, coping is a spectrum, okay? And you don't just break down overnight. You only break down when what you use to cope is overwhelmed. So you should know when to talk to someone. Sometimes merely calling that your friend and talking about the problems that you face might just be what you need to cope for the next day. You know, sometimes asking for maybe 5,000 from that neighbor might just be what you need to move on. So my idea is that, by the way, I think denial is not a good coping method. We say there's no coronavirus anyway. Some people say there's no coronavirus anywhere. That's denial. That will not help you to cope. It is better for you to understand that there is coronavirus and it can kill, and take all the precautions for yourself. Do you understand? And then if it doesn't happen to you, fine and good. They say the best lessons are the ones that you learned either from someone else or from a book. But that you have to experience it yourself. Sometimes you may not live to tell the story. Some people say, if it were happening, why is it that we have not seen it? Do you want to wait until you see it? Go to the isolation center. One or two die. But because their names, you don't know them. So you will feel nobody died from it. The bodies that we saw from UK and Italy and the other climes, they're there. Do you understand? So we cannot say there is no, it's like saying there was no HIV, so you become careless or reckless. No. Wear the face mask. Do frequent hand washing. Keep physical distance. Maintain contact with your important persons. Your friends come and they are sick, please suspect every illness. Send them to the facilities where they need to be treated. If you suspect that you have coronavirus, don't say, God forbid. You know what I mean? No, don't say that. If the doctors or the health physicians, they feel that you should go for a coronavirus test, please do. Oblige them. Do. It doesn't take anything off you. It will only save those that are around you. Because you can be an asymptomatic carrier. Okay, you can actually have it, but you won't come down with it. But if you take it home and let's assume you are living with mama, and mama has an underlying infection somewhere, maybe diabetes or something, she might not survive it. But you will survive it. But mama will not survive it. So you look at the next person, and for the next person's sake, you take the precaution.
Okay, let's take this call before Mr. NKPANG comes in. Hello. Hello.
Yes, Dada.
Hello.
Hello? Okay. Those people should just prepare this.
The other time we were talking about children.
Talking about children, and of course, by 9:30, you are still watching cartoon. But 9:30,
tune into
TV and watch a DigiClass.
Yes.
You get something to learn. All right, there's another call here. Hello. Hello.
Hello.
Hello. Hello. Please always tune down the volume of on your TV set if you want to be part of the program. We are looking at staying emotionally healthy in the new normal, this period of COVID-19, where many things we are used to doing things we are not used to doing before, so to say. And we have two wonderful guests in here. But let's take this call. Hello.
Hello.
Turn down the volume on that TV set if you want to be part of us. You don't need to hear yourself while speaking to us on TV. Dr. OVWIGHO EDAFE is a medical practitioner, is still here, and Mr. NKPANG, a clinical psychologist, is also still here. Let's take this call. Hello. 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 I don't know. Yes, Mr. Pang, you heard him. You also want to add one or two things?
I want to add one or two things to what he is saying.
Let's try this call first, if it's for us. Hello. Hello. All right, go ahead.
Yeah, I want to add one or two things to what he has actually said, a whole lot of things. But living is a choice you have to make. The truth about it is that government will not give you everything you need, especially what in the situation we find ourselves, and let's come to that reality. We can't have everything from our government. But doesn't mean that if our government does not provide for us, must we can pass on. The choice is ours. And this is what makes Nigeria different. This is what makes us different. So the choice to live is our responsibility. And there's this adage that says that when there's life, there's what? There's hope. So if we choose not to live for ourselves, then the hope is lost. So we must keep the hope alive. It's a deliberate, intentional action that must come from us.
Okay. Let's take this call. Hello. Hello. All right. We couldn't. There's another call here. Hello. This is not Sister Rita. This is OGTV. And we are on a live show. This is OGTV, not Sister Rita. OGTV. He said he has been calling repeatedly so that she will not call the same number again.
Mr. NKPANG, let me ask you these questions, and I want you to talk to our viewers now, directly to them. What
after this call,
okay.
After this call. Hello. 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 Yeah, go ahead.
I want you to talk to our viewers now. What should be the psychological tips that you give to our people in this period that will need to keep our mental health very
The one we'll get without coming to the clinic.
Without the one will be used every day.
The first thing I would tell everyone is that COVID-19 is a challenge that we all overcome. There is no need for us to be what? Excessively anxious about. Because that's one thing I must balance. If you're becoming so much conscious about not contacting the illness, then it's a stress on it, it increases your stress level. So first and foremost, understand the experience we all overcome. But that doesn't mean to become complacent about it. Don't be complacent. But do the bits you can do and leave the rest. You know, most of the times you can wash your hands. Ensure you do what? Wash. And when you cannot wash, ensure you have the money to use sanitizer, you do what? Use. But believe in yourself. Don't allow it to overweight. Because once you are excessively worried about it, trying to be much more precaution, that's the hallmark of a problem, because you cannot be so. The more you try to prevent an action, the more you are prone to making a mistake.
Okay. That's a good one. Hello. Hello? I don't know. These little ones are just, we won't leave the phone alone. Hello? No, not for you. I can detect that voice. Hey.
Talk about the need for exercise. Let's try to bring in some little exercise. Exercise is a very simple thing. It's not mean that you must go to gym. Wake up in the morning, walk around your house about 10, 20 minutes before you go to bed. If you want, you can jog. You can do some jumping jump. It helps you live a level of exercise, because by the time you exercise, it builds your inner stamina. It builds your stamina.
Hello, good morning. Hello, good morning. Yep.
Then, aside from exercise, I want to talk about you not entertaining any form of negative thinking.
Okay.
For the fact that people are breaking down does not mean you will break down. Until it happens to you, don't give up. Even if it happens to you, don't give up. In the midst of the challenges, there's what? There's always a way out. So if you believe that there's a solution to every problem, it's an hallmark that you want to do what? Strive and survive in it. But once you lose that thinking, you entertain a fear that, look, these things I cannot manage, these things cannot work out, the tendency that you will not want to take a step of acting on it is high. So it will affect your mental health. For instance, if I believe that this door is locked, I cannot go out of this place. Naturally, if the door is even open, I will not even want to make an attempt. Because the way I think has affected my behavior. I will not want to try it out if there are other ways of opening that door. So I need to believe that that door here might be closed, might be tried now. That will give me an opportunity to do what? To try, to strive, to check it out myself. So you need to believe positive thinking, irrespective of the situation you find yourself. Even if you are down with the illness, might not mean that's dead. It's never ended until it is what? It ended. Believe that you can still come out of it. It's when you have that positive thinking pattern, it helps you to thrive despite the challenges. It gives the energy to want to do certain things, to attempt a task despite the certain realities. Then to learn to cut your coat according to your materials of growth. If you have 5 naira, don't think of spending 20 naira. Learn to adjust to whatever situations you find yourself. Plan with your 5 naira. It doesn't make you you're only adjusting to reality. I want to talk about coping. In psychology, there's another school of thought we believe about positive coping. That's why we don't believe that there's any coping mechanism that is bad or any coping mechanism that is necessarily good. If it helps you to avoid that situation, it's good, move on. If denial will make you adjust your situation, deny, but that does not mean that you stop at denial. Take another step forward of wanting to know more.
Hello. Good morning. All right. If I will add to what he has just said, I will take it from the perspective of the exercise, okay, about things that we can do. There's what we call the deep breathing exercise, and I will encourage senior citizens and middle-aged people to do it every day. You don't have to run around, but you count up to like 4 to 8. You inhale, and you count 1, 2, 3, 4, and you exhale. You count 1, 2, 3, 4, 5, 6, 7, 8. So you do that for like 30 times, okay? So it helps your chest to expand. That's something that can help you when the chips are down. Another thing again I want to mention is stop following the news too much. I mean, what sells? The news too much. You know, news. They say bad news sells. So please, I mean, know when to cut it. So why would you start your day?
You want to say when it is affecting you, stop watching.
No, you may not know when it is affecting you.
Okay.
The thing is, I don't have a control over the bad news, but I have a control over when I will watch it or if I will watch it. So why will I start my day scanning the newspapers, knowing fully well that 80% of what I may see may not be good for me, okay? So you could decide to push the newspapers to the evenings instead of the morning. Stop looking for bad news. 2, 3, it could be, you know, these comedies. Watch comedies. Watch what makes you laugh. Maintain your social connections. WhatsApp, Twitter, Facebook, maintain it. And then the final part which I want to emphasize is that this is a new normal. So you will need to adapt your business. If a lockdown is going to take 7 months, and then we go to another lockdown, you don't know when,
you have to change the way you do business because your finances should not suffer. So if you have to go on Facebook advertisement now, please do. If you have to depend on WhatsApp status, please do. Just change the way you do your business. I've had to talk to people that sell things that are luxury items, and I have to advise them, please, if you know luxury items and then there's cash crunch right now, why not add another aspect to your business?
Survival items.
Yes. Yes.
You should follow survival instincts.
Thank you.
And of course,
it's about economic adaptability. And it's actually one of the things that makes us resilient as Nigerians. Your ability to adapt in circumstances. So you can't be waiting for the lockdown to be lifted. You can't be waiting for school to resume. How about on the 18th and then there's another postponement?
Yeah, that could be.
So you're going to keep waiting for months without salary. You have to do something different. And in doing something different, you are stretching the boundaries and you're growing because you learned a new skill. You are redefining who you are. Last year you were known as a teacher. This year you are now known as a digital entrepreneur. That have added to your CV. And then also it increases your mental capacity because it is protected. It means that at this age where you are, you have had to task your neurons, your brain. So it is protective of you at the end of the day. So I think
in the new normal, it's the first day edition of the program Newdawn with Charity James and I came back today. I want to thank Dr. OVWIGHO EDAFE, medical practitioner. Thank you very much.
Thank you very much.
We benefited a lot from you. And of course, a thorough professional clinical psychologist, Mr. NKPANG. I want to thank you very much also for your contribution to the program. On behalf of Charity James, I remain yours sincerely, Hakim Maki today, saying that Wednesday next week is another day for both of us. See you then. Thanks for watching.